Welcome to my channel Medicine Guide. In the last video we have discussed the different uses of Minipress, Prazosin. Now it's time to discuss its warnings and interactions as a patient's tips, so let's discuss. But before that, please subscribe to my channel Medicine Guide. Now let's start with how it works. Prazosin is used to reduce high blood pressure, hypertension. The exact way Prazosin works is unknown, however. Experts believe it relaxes the smooth muscle lining the blood vessels, allowing the blood vessels to widen, dilate. Prazosin may also block nerve receptors responsible for contracting, narrowing, blood vessels. Prazosin belongs to the drug class called alpha-1 adrenergic blockers, also called alpha blockers. Upsides: used to lower high blood pressure, hypertension. Lowering blood pressure reduces the risk of a stroke, myocardial infarction, heart attack, and other cardiovascular events. Can be used alone or in combination with other antihypertensive agents, such as diuretics and beta blockers. Lowers blood pressure without causing a compensatory reflex tachycardia. This is a counteracting fast heart rate, often a physiological response to blood pressure lowering, or a change in the contraction of the heart or the flow of blood through the kidneys. The blood pressure lowering effects of Prazosin remain consistent even with long-term use. Does not adversely affect blood lipid, cholesterol levels. May be better tolerated by people with diabetes, respiratory diseases, or gout than some other antihypertensive agents. Side effects are usually mild and short-lived, available as 1 mg, 2 mg, and 5 mg capsules. Generic Prazosin is available. Downsides: if you are between the ages of 18 and 60, take no other medication or have no other medical conditions, side effects you are more likely to experience include dizziness or drowsiness that may affect your ability to drive or operate machinery, particularly within the first 24 hours of dosing, when the dose is increased. When going from a lying down to a standing position, during hot weather, after exercise. Do not drive or operate machinery until you know how Prazosin affects you. Getting up slowly may help lessen the problem. A headache, lack of energy, weakness, nausea, and palpitations may also occur, may rarely cause syncope, fainting, or a temporary loss of consciousness, especially when going from a lying or sitting position to a standing position. These episodes may occur within 30 to 90 minutes of taking Prazosin, and the risk of an episode is higher during a dosage increase or when Prazosin is used in combination with another antihypertensive drug. Incidence is approximately 1% in people prescribed dosages of 2 mg or greater. Incidence may be reduced by limiting the initial dose to 1 mg and titrating slowly. Sexual dysfunction is uncommon. Rarely, may cause prolonged erections lasting more than 4 hours. Seek immediate medical help. May not be suitable for some people, including those with low blood pressure, about to undergo eye surgery, or who are pregnant or breastfeeding. Safety and effectiveness in children has not been established. Intraoperative floppy iris syndrome has been observed during cataract surgery in some people treated with alpha-1 blockers. Modifications may need to be made to the surgical technique because there does not appear to be a benefit of stopping alpha-1 blocker therapy before surgery. Prazosin may interact with some drugs, including those that also lower blood pressure or cause dizziness. the safety of prazosin in pregnant women has not been established. Only use if the potential benefit justifies the risk. Use caution if prazosin is used in a breastfeeding woman. Note, in general, seniors or children, people with certain medical conditions, such as liver or kidney problems, heart disease, diabetes, seizures, or people who take other medications are more at risk of developing a wider range of side effects. Bottom line: prazosin lowers high blood pressure but commonly causes dizziness or drowsiness that may impair driving or operating machinery. This is most likely in the first 24 hours, after dose increases, when standing up, in hot weather, after exercise. Tolerance to this effect develops with continued use. Now know some tips. May be taken with or without food. Take exactly as directed by your doctor. Do not take more or less prazosin than recommended if you feel yourself beginning to faint or feeling dizzy or lightheaded while on prazosin. Lie down until the feeling passes. This effect is usually short-lived and likely only to occur on therapy initiation or during dose titration. Do not drive or operate machinery if you feel impaired as a result of taking prazosin. Initial dosages may be better taken at bedtime. Good blood pressure control requires lifestyle changes to also be made, such as stopping smoking, reducing dietary sodium intake, and increasing levels of physical activity. In addition, blood sugars and lipids should be kept within normal limits, and antithrombotic, blood thinning, therapy should be considered for certain people. Many patients require more than one drug to achieve blood pressure targets. Talk to your doctor if prazosin makes you extremely dizzy, if you are falling over easily, if you suffer a sustained erection of more than a few hours duration, or develop unusual heart palpitations. Do not take any other medication, including that bought over the counter, without first checking with your doctor or pharmacist that it is compatible with prazosin. Now have a look on response and effectiveness. Blood levels of prazosin reach a peak within about 3 hours of an oral dose. The blood pressure lowering effect occurs within 2 hours of a dose and reaches a peak at 2 to 4 hours. Prazosin needs to be taken 2 to 3 times daily. That's enough for this video. If you want to watch more videos like this, keep watching my channel. Disclaimer: channel's intention to make this video is for informational purposes only. Consult your doctor or healthcare provider for use of any medicine or for query of any disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guide.